strange for a lot of doctors, a lot of healthcare professionals, because we were taught that this is a disease that people live with, you treat with medicines. And, of course, there were before, let's see, why is this not moving? Okay. Before, of course, there has been, studies to show that things like, low carbohydrates diet, which we know it's like treating the symptoms, because if your sugar is high, then of course, if you go low carbohydrate, you're just avoiding taking carbohydrates. And it's because that's what's going to spike your sugar. That's really not treating the disease. That's just avoiding what's going to raise the sugar. So let's go over some of the misinformation. Some I've mentioned already. It's a lifelong disease. That's what we were taught or we've known. It's has a huge hereditary component. So people, were like, diabetes runs in my family, so they end up getting it. Of course, needing long-term medications and, of course, treatments from complications. It's worsening over time. So somebody can start with pills and then end up on insulin. And, of course, lots of medications and then leading to complications. That's really what it is. And what happens is this cuts, of course, impairs patients, a lot of patients so much in just their daily function. But not only that, costs a lot. It costs a lot. I'll tell you, for example, in the US, chronic diseases in general, 80% of our healthcare spending goes to chronic diseases. And I'm thinking it shouldn't be different from, anywhere else in the world, really. So this is what we have known. So now let's go over to how bad is the situation, though? How bad is diabetes? So I was looking, and this actually might not be the most updated. It's WHO shows that 422 million people worldwide have diabetes. And we are talking where probably 1 in 2 people don't even know they have diabetes, right? They're walking around, their sugar is not, as high to make them end up in the hospital or something. So they are just walking around with diabetes. So it's very prevalent. I'll say 10+% in the world, and 1.5 million people die every year directly from diabetes, either, hyperglycemia, ketoacidosis, complications, everything around diabetes. And it is increasing. In fact, in America, I will speak for America because, it's much higher. Of course, our population is lower when you look at the continents, but, it's much higher. And it's predicted that about 2045, 2050, you will have probably like 30% or so people having diabetes. And that's just diabetes. We are not talking pre-diabetes, because to me, it may not seem as bad, but it's as bad, because if you have high sugar, you have high sugar. It can be just, bad enough to be diabetes. But if you're walking around with impaired fasting glucose, your sugars are not in the normal range, you are going to get complications like anybody else. And of course, you are at risk of becoming diabetic in the near future. So it's just as bad. And there's just so many. I can say that adults in America, probably half of us have. So if you count pre-diabetes and diabetes, you can go up to 40% of the people walking around with just this, high sugars, right? So the goal for WHO is to stop the rise, because as I said, it's been rising. It's rising really fast, exponential rise now in diabetes. And WHO wants to stop the rise in the year 2025. And we can all play a part in this, because I don't know how they're going to do it if they're not going to really be serious about looking into lifestyle and stopping all this, sorry to say, craziness of a medication to fix the problem, because the disease is not, it's not a disease. It's a lifestyle that's leading to like a metabolic situation, so that's what we need to fix. It's not a medication we need to find to cure the disease. So what causes diabetes? Like I said before, we've been like, oh yeah, we see it in these people, these obese people, it runs in families and all these people. But yes, for now, we know that diabetes is caused by, from studies like MRI studies and looking at the fat composition in the body, it correlates with fats in the liver and muscles and pancreas, causing what's called lipotoxicity. Basically, you have chronic inflammation. You have lipotoxicity is basically where you have excess fat, because we have adipose tissue, which stores, because we do need some fat. We do need to store some fat for when we will be starving or when we need, extra energy. So we have that. But when you overfill your adipose tissue, then your fats end up in places where it shouldn't be. Extra, fats in muscles, fats in the liver. Like in America, I can tell you the fatty liver disease is something that is become an epidemic, and probably it's everywhere also in the world. It correlates with diabetes. So you have all these fats in the pancreas leading to this toxic environment, inflammation, insulin resistance. And we know that insulin resistance is what's going to lead to diabetes, because insulin is the hormone that's responsible to put that glucose inside the muscle and liver cells. So the muscle can use it, liver cells, so it can be turned into glycogen and stored for use in between meals. So if that insulin is not working, then those cells are not responding, and they're not intaking glucose like they should. Then guess what? It stays in the blood. There's nowhere it's gonna go. So that's the situation that's happening. Oh my goodness, sorry, I don't think you can see that well, but it says it's a study that was published in the National Institute of Health. It's talking about skeletal intramyocellular lipid metabolism and insulin resistance. So that's why you will see that having all these intramyocellular lipids, inside the muscle cells, liver cells, pancreas, leading to this toxic environment that then leads to insulin resistance and then diabetes. So we know that. And then, so when you look at the studies, because of course, diabetes reversal, I won't say it's something that's new. It's something that people have been looking into, and it has been achieved in some situations, right? If you do bariatric surgery where people lose tons, lots and lots of weight, right? If they restrict their calorie intake so much to under 1,000, people can reverse diabetes. But how can you maintain these things? Bariatric surgery is super expensive, and it also has complications. And then if you go to diets that are so restrictive to less than 900,000 calories a day, who is going to maintain this kind of calorie, right? So these are some of the things that have been looked into in terms of reversing diabetes. But now let's look at more of the stuff that now I am passionate about, and that you are also passionate about. That's why you're here today. So if you look, there was a China study which was done by Dr. T. Colin Campbell in the 80s. So he looked at 65 Chinese counties, and these people were already eating like diets that are plant-based, and they looked at chronic diseases, diabetes being one of them, cancer, and many other chronic diseases. And they found out that, of course, these Chinese people were mostly like eating, plant-based foods. And these diseases were really less, like the incidence was much less in people that were eating more of these plant foods, right? Excuse me. So that was it, actually one of the biggest nutrition study. Dr. T. Colin Campbell is a PhD doctor who did nutritional biochemistry. So look him up if you haven't seen the China study. He wrote a book about it, from this China project, right? So check it out. It's one of those that opened up a lot of doctors into looking into like, how does diet affect, disease, right? There's also Adventist Study 1 and 2 that has also been ongoing for years now. It includes 60,000, over probably now in like 90,000 participants in the North America continent. And these are Adventists, so they're Seventh-day Adventists. And this people have like a spectrum of their diet, because that's really what they were looking at. They already don't smoke, they don't drink alcohol, so they were looking at their diet, right? And they are in a spectrum. There are those that already like eat the SAD diet that I put there, the standard American diet, of course, high in high fat food, high animal food, processed food, and that those that were all the way to just eating plants. You can call them vegans, right? And they found out that the vegans had the lowest BMI, and they also had the lowest incidence of diabetes. So you can see how this was now shedding light to the doctors and the researchers to look into what is it really with the diet that could be doing this. So when it comes to weight loss, because we know that even like from the study I was showing that people have been able to reverse diabetes through losing a lot of weight, either bariatric surgery or just calorie restriction. So what is the best way to lose weight? Is it low fat or high carb, right? Because if you're doing low fat, sorry, I think I confused that. High fat, so it's either high fat, low carb, or high carb, low fat. I'm sorry about that typo. So when you look at these two diets, studies have shown that yes, you can lose weight when you are on high fat, low carb diet, as in keto diet, right? Or if you're on high carb, low fat diet, as in plant-based diet, right? You can lose weight in both. But the studies have shown that the highest weight loss actually happens in high carb diet. Well, I don't know if you're surprised about that, but it actually is in the high carb diet. And why is that? Why is that happening? Because a lot of people with lots of misinformation going around all over the world. In fact, the other day, I thought it was like an American thing where people are into keto diet and all this stuff. But back home, somebody was telling me that, people are eating nyama choma with kachumbari with no ugali because the ugali is going to make them gain weight and it's going to make their diabetes worse and all that. And I'm like, well, now that I know that it's the high fat in the muscles, in the pancreas and in the liver that's causing diabetes, so how good is a high fat diet, as in eating nyama choma and meat and all these other high fat food, going to help with the diabetes, right? It's the same thing as I said, avoiding the carbs. That's just symptoms. It's symptom treatment. It's not attacking the root cause of the disease. So these NIH studies that compared low-fat plant-based diet to low-carb, animal-based diet showed the same. That's what I was talking about. That the people that lost the most weight were in the high-carb diet, and that's something we should be happy about. Like, come on, if you can consume, because guess what? High-carb foods, they're plant foods. That's what it is. Because guess what? Carbohydrates, when it comes to animal food, the only food that has carbohydrates in animal food is milk. The other ones, they don't really have carbs. But look at all the abundance of plant foods we have, all the fruits, all the vegetables, nuts and seeds, legumes, which is beans, lentils, peas, and then all the whole grains, from millet, whole corn, whole wheat, and oats, and all these different. So you can enjoy all those foods and still lose a lot of weight and be able to reverse diabetes and so many other chronic diseases. And if you don't have them, and be able to prevent them, because you can actually keep low weight and low BMI by this kind of eating. And I'm going to talk about it because it's not just the animal food, it's also the processed food. So we want to stay away from the processed food because, of course, they are processed with a lot of fats and oils. And also the oils we use to cook at home. So all that mandazi and chapati and what we call them French fries here, but they are called chips. The chips and all these fried foods, these are also a big problem. So besides bariatric surgery, so food has the most effect when it comes to weight loss. It's not exercise. Like, people are not going to spend 3 hours in the gym, trying to lose weight, or hiking and all these things. It has to do with the food, because again, the weight gain is not just about fat. Like I said, what is it? What the thing is, our body is programmed to store fat, like I said, because we think that our bodies think that there will be a time maybe we'll be starving, so we need a little reserve. We need some high energy molecule, because what fat is a high energy molecule. Each gram of fat is 9 calories. Each gram of carbohydrate And protein is 4 calories. So now you can see why. So fats are high calorie molecules. And when we store fat, we're storing high energy molecule to help us when we want to have food. But I mean, how many people really don't have food now? We just have so much food. We are constantly eating. So we really don't even access that adipose tissue, that fat that we're storing. So if you're eating food that's high fat, which I will tell you that animal food is naturally high fat. The calories that are coming from animal food, 30% of the calories, even what we call lean meat, still 30% of those calories are coming from fat. So it's still a high fat food, right? No matter what it is, steak with what do you call it? The steak and the lamb meat and the goat meat and the chicken and fish, eggs, milk, and all the products coming from these foods, they're naturally high fat, right? And then, of course, like I said, if you're cooking your foods in lots of fat, if you're eating processed foods, food you're getting from the supermarket that are already processed, and you touch this food and like, oh my goodness, look at all these oils, right? All this is going to increase the adipose tissue, is going to deposit fats where it shouldn't be, and it's going to lead to diabetes, right? So food is our defense. This is what we are going to use to fight this. And what is best? Now, I just told you that if you compare high carb diet with high fat diet, when it comes to high fat, actually, you restrict the amount of calories you're intaking, because naturally you're going to have more calories in your high fat diet compared to your high carb. Even though you might be you eat more volume in your high carb diet, but you end up with less calories, because again, the weight gain is not just fat, it's also calories in, calories out. Because if you're eating high fat and you restrict your calories so much, you can still lose weight. But is that a good way to lose weight? 1, calorie restriction. 2, high fat, right? And when you eat high fat foods, they're going to be animal-based foods. It's not going to be like you're eating a lot of avocado and a lot of nuts, which I wouldn't recommend to do. These foods are very healthy, but again, you don't want to consume too much fat. You want to eat more greens. You want to eat more fruit, whole grains, beans, more beans. They have a lot of resistant starch, which is really good for us. And, moderation when it comes to nuts, when it comes to avocado, especially when you have diabetes and you're reversing it. So you want to be careful even with those plant fat, the high fat plant foods, right? So the plant nutrition includes whole grains, legumes, which is the beans, lentils, peas, and these are things we have a lot of them at home. I remember growing up and eating these foods and thinking, man, because we are poor, that's why we eat like this, right? You can imagine people selling their beans to go buy meat instead of that goro of beans that you can eat for a whole 2 weeks. You go sell it and buy meat that you eat one time, and this is the thing, you get all the nutrients you need from plant foods, because even all protein originates from plants. So some studies in the back show that, because we have what's called essential amino acids, which you are aware of, we have to supply them from the diet. So these essential amino acids are very high in animal food. They're very high. But when it comes to plant foods, there are varying proportions of these amino acids. So when the nutritionists saw that, they were like, that might mean that plant foods are inferior protein and animal food is a superior protein, but actually it's not. What we have found is that the way that the plant foods have these varying proportion of amino acid is a good thing. It doesn't stimulate a lot of hormones and causing problems, especially stimulate cancer promoting hormones like insulin, like growth factor, and many other hormones. So that's actually a good thing. Plant protein is superior protein because, again, it's not coming with cholesterol, it's not coming with saturated fats and all these amino acids. The amino acids in animal protein is acidic. It's sulfur. They have a lot of sulfur and it's acidic. And in fact, in studies, it has been shown that the more dairy people consume, the more milk people consume for calcium, the more they have osteoporosis, weakening of bones, because you create an acidic environment by consuming too much animal protein, too much milk, and now you have to leach calcium from the bones to buffer the acid that now that you've created in your body, right? So that leads to weak bones. So this is not a good protein. And the thing with plant-based foods, they're high nutrient. I really want us to understand that, and you probably know it already, but being brainwashed and all these things. But plant foods, that your high nutrient foods, and they have modest calories, meaning that you can eat a good amount, feel full, but you won't consume too much calorie. Compare with fat. Like I said, you can eat a lot of fat, but because it doesn't have fiber, it doesn't have other nutrients. When you eat it, you still feel like you're not full, and you keep eating, so you consume more calories. Again, the more calories you have, it's going to promote that weight gain. So the culprits to avoid when it comes to diabetes reversal is animal foods of all kinds. Like I said, it's because of this accumulation of excess fat in muscles and liver and pancreas. So you want to avoid animal food, you want to avoid processed food, you want to avoid fats and oils. And this becomes, something people are like, oh my goodness, like how do you even cook your food with oil? I cook my food for 1 year now. I've been plant-based for 15 years, but just in the last 1 year, I learned about oils and how they cause inflammation. It's not just about calories, empty calories, but they have too much omega-6, which causes inflammation and causes endothelial damage. So inside of your arteries, the endothelium, which produces nitric oxide, which causes vasodilation, so you damage that endothelium, and guess what happens? You have constriction of your blood vessels, you have injury to that blood vessel, which then makes it easy to accumulate cholesterol, plaque inside those vessels. And then now you have heart disease and so many other cardiovascular problems, right, that come with that. So we want to avoid this cooking oils. The other day I was, watching my friends from Kenya, they were complaining how oil is expensive. And I'm like, man, please, you don't even need it. Like, stop using the oil. Well, when I cook my vegetables, I do use like peanut butter, but the peanut butter doesn't have any oils added. It's just natural peanut butter that has been processed. I add it just to make my vegetables creamy, my skumas, my sagas, I also get those here. So I use that to make them creamy. But when I cook my beans, I saute my onion with water. I put fresh garlic. I put my tomato. I put my spices like cumin, turmeric, paprika, coriander, and put all these spices. And I cook my beans without oils, right? And all my other foods. I bake my foods with parchment paper in the oven. I don't use oil now at all. I cook even chapati without oil, but I don't eat chapati a lot. But when I do, I cook them without oil. So that's what really to focus on. And I want to leave some time for questions. I don't know how much time I was told. It was 30 minutes, but I want to finish a list so we can have time for questions. So when you eat like that, you are going to lose weight. People are going to lose weight. Like I said, because these plant foods are modest calories, people are going to lose weight. They're not going to consume all these high fat foods to have all these fat deposits, because fat is what leads to weight gain. It's not carbohydrates. It's not the healthy nduma that we eat and sweet potatoes and whole corn that we eat from ugali and millet. That's not the problem. It's not the fruits. It's not the beans. It's not that. It's the fat that we are consuming too much in processed foods and animal food because we can afford them, And these oils that are now everywhere, my goodness, when I go to the store and I'm like, what is happening? Like the oil aisle is full of different oils and of course, all these processed foods. And I'm like, there should be a big produce section, right? With fruits and vegetables and all that. And of course there are, I'm not saying they're not, but it's just baffles me how much processed foods we have in the stores, right? So you want to also focus in other lifestyle. Exercise is important. Of course, exercise does promote insulin sensitivity. Sleep, a lot of, sleep affects hormones, affects how we eat, and stress management, social connection. These things are in my book. So if I don't know if Amazon works back home, but it worked for Australia, because Dr. Menge got his copy. But these are some of the other lifestyle things I addressed in my book in terms of changing lifestyle to really promote health, getting sunlight, how that affects our immune system, how it affects our blood pressure and our mood and our sleep, so many things, being out in nature, because now we work inside, people don't want to go outside, they have low vitamin D and all these different problems, people don't get enough sleep. Either sometimes it's even intentional. People are just, working and they're going to school, that we're doing all different kinds of things. And people maybe staying up watching YouTube. I don't know what other, people don't value sleep, but sleep is very important for our health, and drinking water, making sure that we are hydrated. So these are some of the other lifestyle things we want to focus on. So the reversal happens when we decrease the fat content in the body, and we're going to do that by decreasing the fats we are eating. And plant foods increase metabolism. So that's another thing. You increase metabolism, you're going to burn that fat that it's already accumulated inside the cells, and that is going to decrease that, fat content and lead to insulin sensitivity, because insulin resistance came by because of high fat. So by lowering fat, you restore insulin sensitivity, and that's what you want. You get weight loss, fat loss, insulin sensitivity. And this is not only for diabetes, it works for many, many chronic diseases, from heart disease, from high cholesterol, high blood pressure, autoimmune diseases like thyroid disorders, and even type 1 diabetes has been linked to to dairy intake, the milk that we so love. I am kissy, and I didn't struggle as much. I won't say I struggled so much, but I used to drink like 2 cups of milk every day when I was home. Fresh milk, make tea, and then we call it maruranu, the cattle milk, with our ugali. I had to stop all that. I don't use any animal foods at all completely, but I do want to say that you want to encourage your patient to get vitamin B12 supplement, because vitamin B12 is made by bacteria in the soil. And because a lot of us are not getting food from our shamba, our garden, we're buying it from the supermarket, it's washed so much that, again, there's not enough soil there. Probably you need like 2.4 micrograms a day. So I do tell people that, get a vitamin B12 supplement. You take it because you need 2.4 micrograms. It's very small. Take it every 2 to 3 days and you'll just be fine. Some people are just fine not taking it, but for me, I just take it, to be cautious. And I recommend for people to take it as well. But other things, like vitamin D, like I said, people need to get outside, because vitamin D is very important for our health. A lot of receptors, cells in the body have receptors for vitamin D. So it's not just musculoskeletal health, it's cardiac health, it's immune health, it's so many other things. So vitamin D is another one, especially for us in North America. We get these rough winters. We probably need to supplement, and as much as we go outside. So there are doctors who are using plant-based nutrition to reverse diabetes. Check them out. Dr. Neil Barnard, these are some of the pioneers in America of lifestyle medicine, of using plant-based nutrition to reverse diabetes. And he runs, he's a clinical researcher, right? He has his own medical center, and he runs this, studies. Dr. Dean Ornish, he does heart disease reversal through lifestyle changes, and the top is, of course, plant-based nutrition. Dr. John McDougall is another one you can look up. Dr. Joel Farman. These are all doctors who use, who are pioneers. And there's so many of them. I couldn't put them all there. So I'm going to leave time now for questions, so I don't just keep talking.